Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.
You're listening to Healthcare Matters, the podcast that pulls back the curtain to help you make sense of complex healthcare economics and policy issues. With us, as always, is Dr. Robert Popovian, joining us from Washington, D.C. He's a pharmacist, economist, and the Chief Science Policy Officer at the Global Healthy Living Foundation.
And joining me is my good friend, Conner Mertens from Seattle, Washington, my co-host, and our Community Outreach Manager and Patient Advocate Extraordinaire. And that's not all. Today we are also joined by JP Summers, our Patient Advocate and Community Outreach Manager as well at Global Healthy Living Foundation, who not only works for GHLF, but she happens to be a chronic disease patient herself. And today we have a very special episode, and we're going to talk about this important topic that JP is going to explain to us from both a GHLF perspective, but also more importantly from a patient perspective.
Yeah, we're actually recording this episode right after you yourself and JP and some of our other GHLF colleagues are finishing up a really informative webinar that we're going to tell you a little bit more about in a moment.
Thank you, Conner. It was a great webinar, and I would highly suggest that people go ahead and listen to it. It's going to be posted on YouTube, various other channels. We're going to have it in the show notes for you to be able to follow and see where you can see the webinar if you missed it. But we have a lot to discuss today here, and we want to definitely talk about the webinar. But Conner, as always, I'm going to throw out a number to you, and the number today is 19.
Oh gosh, Robert, 19. I'm watching a lot of the World Cup right now. 19 is Crystal Dunn for the U.S. women's national team?
I believe she may be, but that's not what we're going to be talking today, even though Women's World Cup is a very interesting topic. No, 19 is the 19 states that have passed legislation to protect patients against predatory sort of policies that have been implemented by the pharmacy benefit management companies and insurers called accumulators and maximizers, and these states ban those type of policies and protect patients.
All right, Robert, I guess meat and potatoes. What is a copay accumulator adjuster?
Okay, so a copay accumulator is when patient assistance is provided by a manufacturer, a drug manufacturer, to the patient, and the patient is able to use this patient assistance to cover their out-of-pocket costs. And before accumulators were being implemented or maximizers were being implemented, patient would show up to the pharmacy, utilize that assistance, pay for their out-of-pocket costs, and that out-of-pocket cost payment would apply to their deductible or to their maximum out-of-pocket cost requirement. Through the implementation of these schemes called accumulators, now none of that amount of patient assistance applies to the patient's deductible or maximum out-of-pocket costs. So in essence, what they've done is to steal the patient assistance from the patient to pad their bottom line. These are the insurers and the pharmacy benefit management companies, and keep the patient in what I consider a perpetual deductible phase that unless they pay the deductible out of their own pocket, they're not going to be able to meet it. So in essence, they're basically profiting from this program, and they're double dipping. They're not only using the patient assistance program from a manufacturer as profit, but they're mandating that the patient then has to pay for their own out-of-pocket costs, which in the past was not the case. They were able to meet the deductible through these patient assistance programs.
Yeah, I mean, that's what it kind of sounded like when you were describing it. It's double dipping. That's kind of the perfect way to describe it. So does this kind of look like in practice? And I think we should throw to JP in a second to hear what her perspective is as a patient. But let's say your deductible's $1,000 and you get some copay assistance program through the manufacturer that gives you, $500 coupon for your medications. So does this mean that that $500 coupon is not going to count towards your $1,000 deductible and you're still working towards that $1,000?
That is exactly it, Conner. I couldn't have explained it any better. What it happens is that dollar amount that comes from a manufacturer never applies to the deductible, and therefore you as a patient have to pay for it out of pocket from your own pocket. So now we're going to go to JP, and I want JP for you to talk about your own personal experience. Obviously, you work for GHLF, you work with our patient community every day, but more importantly, you're a patient yourself. and I want you to tell the story of how accumulators as a policy implemented by the Pharmacy Benefit Management Company and insurers have impacted you.
Sure. Yes. As a patient, my first experience with Copay Accumulator happened after I was diagnosed with chronic migraine, and I had tried several medications. Nothing seemed to really help. My neurologist suggested a treatment that was actually as a specialty treatment. Got help with the Copay Assistance Patient Program. Everything seemed okay. And then a few months later, all of a sudden, I went to go pick up my prescription and was told the amount changed, which I was surprised because, again, I had this assistance. How is that even possible? So then I made phone calls, and by the time I got answers, I realized that it was under the Patient Accumulator Program. And at that point, I didn't know much about it. So, of course, doing research, learned even more, got upset. And then when my son, who also was diagnosed with chronic migraine, had the same situation happen with his treatment, all of a sudden now we were faced with, a huge dollar amount for prescriptions. And I made the decision, which was really a dangerous decision. You should never stop taking medications, especially if it's something that helps you to live a better quality of life. But financially speaking, we were a one income household at the time because I was not working. And we had other members of our family that relied on things. So again, I decided not to take my medication so I could afford his. And never in my life did I ever think that I'd have to choose a loved one's health over mine. No one should be in this situation. No one should ever have to choose another one's health over theirs. But I made that decision. And when you go through something like that, it's not just a financial burden, it's emotional and mental. Because again, this is not something you should have to worry about. You should be able to take your medication that helps you to function, that helps you to be a parent to your children. And it just was a hard situation that not just myself, but my family went through at that time. And I would never wish that on anyone. And when these situations happen, patients often have to sacrifice something in order to get those treatments, or they don't get the treatments because they can't afford it.
Well, thanks for sharing all that, JP. I know that that's a really important story, and I know that you find value in telling these stories because, as we've seen, advocacy has the power to create change, and your stories have the power to create change. I know you've been involved with a few different advocacy days around the country around this issue. Can you tell us a little bit more about that?
Sure. Yes, Connor. So in my situation, being with GHLF, I had the opportunity to do advocacy days, but also because of my dual residency, I had opportunity to testify in Texas. I spoke at a press conference in Wisconsin, and being able to share the story again was impactful on so many levels because, again, it's something that my family went through, but also to raise awareness. And as I'm telling this story to people in the position to help make that change, I feel that, again, my voice can be very impactful, as well as everyone else on the coalitions that were there to help share their stories. But when Texas, again, was in the middle of making the decision on whether to pass the bill, I was sharing my story, and sometimes it can be difficult. But again, I do it because I want to help other people. And I was so thankful for the opportunity to be able to speak in front of those lawmakers. And thankfully, our efforts with GHLF on our side and the other coalitions, Texas was able to pass that bill.
I mean, that's great. And like we were saying, it's a testament to your ability to humanize these issues, which is so important when it comes to advocacy. So thanks for sharing your story, JP. But in that same vein, Robert, we see legislation all over the country and federally about Copay Accumulator adjusters. I personally live in a state where I'm protected by that, by Copay Accumulator bans in Washington State. But we also did some advocacy days in Oregon and California this year where they don't have those protections. And one of the things that kept coming up was this idea that Copay Accumulator adjuster bans will raise premiums. And I know that you've done a lot of work, and along with many others in our organization have done a lot of work to kind of prove this myth wrong. Can you tell us a little bit more about what GHLF and yourself and our other colleagues have found around this idea of rising premiums in the face of Copay Accumulator bans?
So the short answer to that question, Connor, is it's absolutely false. We've looked at it for the last 2 years. We obviously released a tool that is available to anyone for free to go and take a look at it. And what we found last year is that there was no statistical differences between states that had passed the bans and the state that had not passed the bans, or even within the state, whether or not the ban itself had an impact on premium increases. So what the narrative that the that PBMs and insurers are providing everyone is absolutely false about this type of legislation. Now, 2023, we've re-released an updated tool with better visuals, as well as, updated the number of states, obviously. Washington State, Connor, you live there, as you mentioned. You are protected. They passed it last year. Texas, that's where JP lives. She is protected now because the legislation was passed this year. I live in Virginia. Virginia was one of the first states to pass legislation to protect patients. Ben, our producer, lives in Indiana, which is not being helped yet. Hopefully next. He's not protected yet. But, large and small states, Texas, we're talking about Oklahoma or Virginia, have passed this legislation to protect patients versus if you look at their blue states that have passed it, New York and Illinois. So this is not a partisan issue. This is not a small or big state issue. We have states like Texas and New York passing legislation to protect patients. If you think about it, they're polar opposites from a political standpoint, but they found a commonality of protecting patients at the end of the day, and that's what matters. At this time, I would like Ben, our producer, to also put in a clip from our webinar because Anne Sydor, Dr. Anne Sydor, who's a good colleague of ours, does a great job of explaining about the tool and how it could be used, the website and everything else, and also where the data came from, as well as another colleague of ours, an economist, Esteban Rivera, is going to be able to explain how we did the statistical analysis. So please listen.
Thank you so much for the introduction, Robert. The data for this analysis comes from the Healthcare Information Exchange database, which is a repository of all premiums for the ACA plan and can be used really as a proxy for how insurance premiums have changed from year to year. So this is a publicly available database. Anyone can go and look at this data. It is a large amount. There are dozens and dozens of insurance programs from state to state. What we've done is we've taken the average premium for each of the metal tiers. So there are different levels of insurance, bronze, silver, gold. We've taken the average for each of those tiers for each state in a given year. And we looked at how states compare from one to the next. We've also looked at how states with bans on accumulators compare to states without bans on accumulators. So when we look at this website, again, this information all comes from the Healthcare Information Exchange. We also have terms defined. A lot of people aren't sure whether or not they have an accumulator or a maximizer in their health insurance policy. Accumulators and maximizers affect patient assistance programs. If a patient has a $1,000 deductible and they get $500 in the form of coupons or copay assistance or any other assistance to afford expensive specialty brand name medications, that $500 that they pay with a coupon used to go towards their deductible. With an accumulator or a maximizer policy, that no longer happens. They pay the $500 from the assistance program, but instead of having $500 left in their deductible, they still have $1,000 to pay. Then when we come down and we look at this graph, what you see that's really important is the shape of these lines. The blue states might be a little bit higher, the orange states might be a little bit lower, but the rate of change, the rate at which insurance premiums go up or down is the same in both blue and orange states.
So the question here is, did enacting legislation cause a statistically significant increase in premium prices when comparing that to potential increases to previous prices? I'll explain why the answer is no to that question using an example. When analyzing prices in 2022 in a specific state that passed legislation in 2021, one needs to take into consideration what previous prices were in that state and how it compares to the overall averages. No matter the selection of the state in this example, the ANOVA test shows and proves that there is no significant statistical relationship between the passing of legislation on an increase in premium pricing. One way I like to think about that is that this year's price is dependent on all the previous year's prices. So averages were already increasing over time, and that is the key factor to pay attention to here.
And the truth is, no matter what we call it, whether we call it coupons or copay cards or patient assistance programs, whether it's a subsidy, whatever it is, it's a mechanism for an organization, whether it's a pharmaceutical company or a charitable organization, it's a mechanism for them to cover the costs that the patient would pay. The share of the drug cost, the share of the prescription that would be borne by the patient and family.
Just some amazing information from our colleagues at GHLF, really breaking down this issue of copay accumulator adjusters. Gonna let you get your last word, Robert, but I really learned about this. It's just a myth. The people opposing copay accumulator adjusters, the powers that be, push this narrative that we're gonna see these rising premiums, and that's just not the case. And it's amazing the work that you and other folks have done in GHLF to show this in a very visually appealing way, but also just a very open and transparent way where all the data is sourced and available. So yeah, it's just a credit to all around to you folks for digging into this and making sure that this information's out there. What do you say, Robert? What's the last word?
The last word is that we've passed it in 19 states. We need to pass it in the rest of the states to protect patients. We need to pass federal legislation because, state laws don't govern every state insurance plan. Therefore, we need federal regulation and federal legislation. There is a federal bill that is pending in Congress. As advocacy organizations, whether it's patient advocacy, provider advocacy, employer advocacy, we have to all come together to be able to protect, because all of us at some point in our life will be patient. I guarantee you that. As a pharmacist, I can tell you 100% for sure you will be a patient at some point in your life, and you will need that protection from the predatory schemes of the PBMs and the insurers.
I couldn't agree with you more. Thanks for that, Robert. And thank you to JP Summers for joining us on this episode again. Happy to have you back anytime. Big thank you to the other folks involved in this copay accumulator work, Esteban Rivera, Anne Sydor, and just countless other people doing work behind the scenes at GHLF. It's really impressive what they've been able to churn out. And for our listeners, don't forget to subscribe to our podcast on Apple, Spotify, or wherever you might be listening so you never miss an episode. And if you have a second, help spread the word by rating our podcast, writing a positive review, and sharing with your family and friends. It'll help more people like you find us.
If you have any questions, thoughts, suggestions, comments, anything, any ideas for future shows, please send it to us via email at podcasts@ghlf.org. We always look at them, and hopefully we will pick up some ideas that we can run the future podcasts about.
For more information on copay accumulator adjusters, please visit ghlf.org/copay-assistance-protection. And that's a little long, so be sure to check out the link in the notes. As always, he's Dr. Robert Popovian.
And he's Conner Mertens. See you all next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.